And you've interacted with some of these nurses and whatnot. What would you postulate are some of the biggest time wasters for nurses? I remember we were doing a project at one of our flagship hospitals, and it's sometimes it's the silly stuff. Like we were talking to these nurses and we're like, what's the biggest time waster? And they just, without batting an eye, they were like walking to that printer from here. I was like, really? Yes. We make that trek. And it wasn't all that far, relatively speaking. But when you multiply it times the number of, if you put a printer right here, you're going to give me back maybe 15 to 20 minutes a day. I was like, oh, you're kidding me.
So yes. So I don't disagree with you. I think some of it, though, is still documentation. And so I know that there's a bunch of different initiatives. I know Dr. Engelbright, that was out of HCA, who is recently retired, but had a big push in trying to really relook at what the nurses are documenting. There's a challenge. Is anyone really looking at all of that data? Or should they document by exception? Or is there a different methodology in which to do the documentation? I do think as we start to get into some of these virtual assistants and some of these AI, we could see changes. I know we're focused so much on the physicians these days, but I do see that this is also an area that we would be able to develop and bring in the nurses and really make some change. But to your point with the printers, I think most of the organizations these days have really gone through that lean process, because they identified, and it was almost like you mentioned, it's almost by accident that they're identifying different areas in which to cut down some of the waste and burden and get the nurses to not do, as you mentioned, these silly small things and move a printer here and there. But a lot of them have gone through that lean process to really understand. It's almost putting a GoPro on the nurse, right? Finding out what they do on their daily shifts.